So, hello students, can you hear me? Let me just check. Okay, so still few seconds is there and we can start the session now, and this is the Grand FMGE December session 2021 Anatomy Quiz Part 2. So, actually I have today and tomorrow I have segregated to the sessions. So, the sessions will start. So, I am starting with the second part. First part has already been covered up. And now we will cover up the sessions in the another 4 sessions I will take consecutively. So 2 p.m. session is the first anatomy quiz part 2, then 3 p.m. is third part, and 2 p.m., 4 p.m. and 6 p.m. and then tomorrow in the morning, that is Saturday 10 a.m. So consecutively one after the other we have got the anatomy quizzes targeting FMG session 2021. So all the students can join me for this session. This will be extremely beneficial because this will be quickly covering all the important anatomy MCQs targeting FMG session 2021. So let's start with the session. All the best students. So let's start it. Shireen, yes, yeah, Abraham, welcome to the session now. So before starting the session, a quick review of myself and the platform of Unacademy. Myself, Dr.Monalisa, have done my MD Anatomy from Armed Force Medical College, Pune. This is my referral code, or this is the ANAT 10, which is my referral code or the unlock code, which can be used if you want to see my sessions on the special free platform of Unacademy. I also want to tell that Saturday evening, so when I am talking about the Saturday, those who are still there, so Saturday evening and Sunday. So Saturday evening and Sunday, so evening I will take 3 sessions and on Sunday 2 sessions, so total of 5 sessions. So these sessions are targeted for the examination of FMG and INICT. So I will take image based cadaveric MCQ sessions on the special platform of Unacademy. Yes, Shri, good afternoon. Yes, Shireen, Abraham, good afternoon to everyone. So today there is YouTube 5 sessions, total 4 sessions are there, 3 today and 1 on Saturday, and on the special free platform of Unacademy, where you can get the PDF notes also. You can join me on Saturday evening 6 p.m., 7 p.m. and 8 p.m. session like this, and on the next day, that is Sunday morning, also the special free session will go on. So be present for this. Now, what are the benefits of this special free sessions on the Unacademy platform? What are the benefits? So actually the benefits are more than that what you receive on the YouTube. So it's an interactive live session where you can interact with the top educators of Unacademy platform. Polls are conducted among the learners. Raise your hand and get your doubts cleared right itself when the session is going on. Never miss a session. So always when you want to see the session, actually if you want to see the session, for example, if you are liking my session and you are following me on the Unacademy platform, so you just click on follow me on the Unacademy platform, you will get the notification of all my special sessions and the plus platform session. So after completion of the session, you will get PDF notes and lecture notes will be provided to you anywhere, anytime. Study from the top educators of Unacademy platform and at your own pace. So just grab this opportunity and use the code ANAT10 if you are if you are downloading the Unacademy platform and you are seeing the free session for the first time. So what you can do, you can use the code ANAT10 to unlock the session. Now, my dear friends, what about the plus subscription? When I am talking about the plus subscription, the benefits of plus subscription is that you will get all 19 subjects in a very systematic way. So you can target all 19 subjects in a very systematic way. SS both recorded and live version. If you miss any of the session, you will be present with the live recorded version of it. So you can either attend live or the recorded version. Study from India's top educator. Assess more than 25,000 MCQs made by the top educators of Unacademy platform. Compete in live tests and quizzes. And soon is there the printed notes provided to you. So iconic subscription. When I am talking about iconic subscription, there is merging of the Unacademy Plus platform and the Prep Ladder platform. So just grab this opportunity and get the benefits of both the platform, both the best platform for the medical stream examination. So clinical integrated versions, essentials, video lectures, QBank 3, rapid revisions and snapshots, and also printed notes of the Prep Ladder will be provided to you. So just grab this opportunity, my dear aspirants. Now what is all about, what I want to tell you is here, I want to tell you about, so I just want to tell you about this NEET PG subscription and the Iconic subscription. So if you want to be the part of NEET PG or Iconic subscription, the comparison of 18, 24, 36 month all is there, and all these benefits of the Plus and Iconic has been compared up. So just go and use the code ANAT10 and take the subscription and get 10% discount by using this code ANAT10. So grab it. Also, I want to tell that upgraded highly effective QBank is there of Unacademy, where you can assess all the 25,000 high yield clinical MCQs from all 19 subjects based on the latest pattern of examination. Includes a detailed explanation for each and every MCQ. So just grab it and use the code ANAT10, as here I have written, use the code ANAT10 for 10% discount of taking the subscription. What else? So boost your medical PG preparation, valid till 21st October. Okay. So you can take the 2 years of subscription and get 4 months of subscription absolutely free, get 12 months of subscription, get 2 months of subscription absolutely free. Now exam day is coming near, so free grand test series is also present on the platform of Unacademy. So free grand test series for the next aspirants, this is on 24th October Sunday, timing is 2 to 5 PM. एंड फॉर द FMG एस्पिरेंट, सो INICT के लिए आपको 2 से 5 बजे on the 24th of the October. And if I talk about FMG aspirants, they have got also the test series on 31st October. Timing is 10 AM to 1 PM, 300 MCQ. So be present there, enroll in this MCQ series. So use my code ANAT10 and get enrolled for this free test series targeting INICT examination and FMG examination. Also there is a free test series for the NEET PG aspirants. So NEET PG aspirants के लिए the test is on 23rd of the October, that is Saturday, that means tomorrow. Grab it, use the code ANAT10 to enroll and be present for this test. Raise your hand, ask your doubts to be cleared in the special free sessions on the Unacademy platform. I also want to congratulate the toppers. Who have acquired a very good marks in their entrance examination of NEET PG September session 2021. So all the best for the future tenures. So my dear aspirants, should we start with the MCQ session now? All the students I know are waiting for this MCQ session. So let's start with this MCQ session, extremely beneficial. So, okay, so today, as I told you, this is the first session. So today I am taking 3 sessions and Saturday in the morning 1 session. So these 4 sessions are targeted for anatomy quiz. And on special platform again clinical and that of image based MCQ sessions will be 5 MCQ sessions, will be starting from the evening of Saturday and ending in the morning of Sunday morning. All these links will be provided in the Let's Crack NEET PG platform of Telegram group, also in the group of INICT Unacademy NEET PG platform. So you will get the link and you will get, if you are using the platform for the first time, use the code ANAT10 and unlock it and be present. Okay. So let's start. False statement about the clavicle. Okay, false statement about the clavicle. So which of the following, we have got 4 options and you have to tell me which of the following is a false statement, not a true statement about clavicle. Ossifies into membrane, horizontal bone, no medullary cavity. Most common site of the fracture is medial 1/3 and with the lateral 2/3. So Sri has given the answer. What about others? Sri has already given answers. I am just waiting for the others so that I can proceed. So I will wait for every MCQs. I will wait for 15 to 30 seconds so that everyone can give their answers and then I will proceed with the next. So I have got till now only Sri has given the answer. What about others? So okay, and it doesn't matter, my dear aspirant, it doesn't matter whether the answer is right or wrong. What is important is participation in the quiz, and I am here to explain each and every MCQ. So if you are solving the MCQs along with me, means the revision of anatomy will be done along with me. So yes, Tani Pal has also given the answer. Okay, so I got 2 answers from Tani Pal and Sri Rangraj. Okay, so my dear aspirant, the answer given by both of them is absolutely right. The common site of fracture is junction of medial 1/3 and lateral 1/3. The wrong statement, actually the junction should be medial 2/3 and lateral 1/3. Got it? My dear aspirants, the exact junction should be medial 2/3 and lateral 1/3, not that of medial 1/3 and lateral 2/3. Okay. So let me show you this clavicle bone. Actually, when I am talking about a clavicle bone, it's a very atypical bone. Why it's a atypical bone? So there are many special features of clavicle bone which signifies that it's a atypical bone. Why? Because it's a type of long bone, and we know that in our body long bones are lying vertically, but this is a bone which is lying horizontally in our body. So this is a long bone which is not lying vertical in our body, but it is lying horizontally in our body, and as you can see it is also having medullary cavities, and its ossification is most of the part, it is membranous ossification, and sternal end is enchondral ossification is there, and it is a bone which is having the primary center of ossification. So there is two primary centers of ossification. There is two primary centers of ossification, and they appear very early by 5th week of intrauterine life. Generally, the primary center of ossification appears by 7th to 8th week of intrauterine life, but it is appearing as early as 5th week of intrauterine life. Now, my dear aspirants, I also want to show you a diagram where your, so see here, this is the medial end of the clavicle, as you can see, because this is the sternal end. So this is the sternal end which is articulating with the sternum of the clavicle, and this part as going towards, as you can see here, going towards the acromial processor. So this is the lateral end, and the most common site of fracture is medial 2/3. So you can see here, this is medial, this is M. So this is here, this will be medial 2/3 and this will be lateral 1/3. So see here, the junction is medial 2/3 and lateral 1/3 is the junction where the fracture, this is the common site of fracture of clavicle bone. So that was the wrong option. Okay, let's move on to the next. All the best to everyone. So let's move on to question number 2. Identify the given, okay, so yes, identify the given. Okay, let me just, yeah, is it okay, is it visible? Yeah. So identify the given histological slide. So all of you see the slide, and there are 4 options: serous salivary gland, mucus salivary gland, mixed salivary gland, and adipose gland. 4 options are there, and you just give me the right answer. Identify the given histological slide, which is the correct one. Dr. Dasa, you are absolutely right for the question number 1. So now you will write question number 2 and you will give the answer. So this is how we will conduct the quiz. Identify the given histological slide. So Nij 10 is telling D. Okay, I am getting D as the answer. What about others? So waiting for others to give the answer. So yes, I will provide just 15 to 30 seconds. So everyone, 15 to 30 seconds, 15 to 30 seconds. Shri is telling it's A. Okay, so I am getting mixed bundle of answers. I am getting A, I am getting D. Okay, so what according to you is the best answer, dear? What according to you is the best answer? Okay, so let me come up with the explanation. So yes, Shireen is telling B. Shireen is telling B. And my dear aspirants, Shireen is absolutely right. It is a mucus salivary gland. So Shireen, you are absolutely right. Yes, it's a mucus salivary gland. So firstly, before coming up in this histological slide, I will give you a table of differentiation between serous and the mucus acini. So let me just enlarge this image, and I will give you a table in which you can clearly see the differentiating point between the serous acini and that of the mucus acini. So see here, one side the serous acini is written, another side the mucus acini is written. So let's see the difference between serous and that of the mucus. So when I am talking about the serous acini, what you will see, if you will compare the size, so see here, if you compare the size of the serous and the mucus, I am just highlighting it. So what you can see, the larger is the mucus. So 25% size if you compare, so see here, I have included 2 diagrams. Okay, here 2 diagrams has been included. See here. So here you can see the size of the mucus acini is slightly larger as compared to the serous acini. Okay. Also the cell is tall pyramidal. If you will see the individual cell, it's tall pyramidal and it is truncated shape in case of the mucus acini. So see here, if I just enlarge this acini, so this is the mucus one and this is the serous one. So what you can appreciate, the serous size is tall and pyramidal, and this is truncated. The shape is truncated. Individual shape का truncated है, यहाँ पे tall pyramidal है. So, but this can be appreciated only in the enlarged view. Now, the other important point of difference which you can see here is the nucleus. So, see here, in this case, in the case of the serous, the nucleus is rounded. The nucleus is rounded, but in case of mucus, the nucleus is flattened and it is pushed towards the periphery. As you can see, it is pushed towards the periphery. The lumen, compare the lumen is larger. So, in which case the lumen is larger, my dear aspirants? किस case में lumen larger है? किस case में lumen larger है? It is larger in case of mucus acini. It is smaller in case of serous acini. Got it? Yes. So, see here. So, these are the points of difference which I once more want to target this. See here. This is the points of difference which I have shown you already, the enlarged view of this diagram which I have made, which will help you to differentiate the acinis of the serous and the mucus. Lumen is rounded in case of the serous and it is larger in case of the mucus. The nuclei is rounded and basal in case of serous. It is flattened and pushed towards the periphery, basal in case of mucus. Why? Because the nucleus is flattened out because of the mucus secretion, which is thick and sticky. The staining property of the serous is it contains dark eosinophilic and inclusions are basophilic. It is lighter stain. Mucus is very lighter stain. Now see here, I would like to show you this diagram. This is from the Atlas de Fures Histology PDF, and you can clearly see the comparison of the mucus and the serous acini. Let me slightly enlarge it. So all of you, I am enlarging this slide. Why? To make you understand the difference between the mucus and the serous acini. So see here. So this is one of the mucus acini. Okay, this is one of the mucus acini. This is the nucleus which I am showing, and yes, exactly, the nucleus is pushed towards the periphery. This is the lumen. Okay, so this is the lumen which you are seeing. This is the lumen, and this is the individual cell. So this is the individual cells, and you can see it is truncated in appearance. It is larger. So this is which acini? Which acini is this? This is the mucus acini. This is the mucus acini. Now let me show you the other one, that is the serous. So now I am taking an example of serous. See here, this is one serous acini. So you can see here a very invisible small lumen is there. The nucleus which is shown here is rounded and the size is also small. So this is what, this is the acini. This acini is serous. So mucus and serous, can you differentiate? This is a slide which is containing of, this is mixed salivary gland which is showing both the mucus and the serous acini. So this is one serous, this is serous, this is serous, this is serous, this is serous. These are all SS, serous. What is this? This is mucus, this is mucus, this is mucus, this is mucus. Now I am taking an example of this mucus acini where the lumen has been seen, nucleus is seen, and as you can see here, nucleus is pushed towards the periphery, the lumen is seen. Okay, and also the serous acini. So can you see here, this is called as serous demulans. What is it? It is called as serous demulans. What do you mean by the word demulin? Serous demulin का मतलब होता है mucus acini is wearing a cap of serous acini. So here this is the mucus acini, this is one mucus acini, and this mucus acini is wearing a cap of serous acini. So this view is the serous demulin. So this is the basic difference between the mucus and serous acini which I have shown you in this diagram. Okay. Now my dear aspirants, now this was the slide which I have asked you. Now my dear aspirants, can you see this acini, this acini, this acini? Okay. What is this acini which is very lighter stain? So here the lumen is in the center which is slightly not clear, but these are the lumens and its size is larger, as you can see here. This is also the lumen which is shown and the nucleus is lying here. So this becomes a mucus acini. This becomes a mucus acini, and we know that mucus acini are in large number in sublingual gland. In which gland? In sublingual gland. So is the doubt clear, all of you? Let me know. All of you, is the doubt clear? Are you now satisfied that this is a slide of? Are you now satisfied that this is a slide of sublingual salivary gland or mucus acini? Everyone, let me know. Let me know. So the answer of second is B. So yes, I got Nirja 10 has given the right answer. Shireen, all others, those who have made a mistake. Is it clear? Now let's move on to the next MCQ, that is MCQ number 3rd. Okay. Okay, okay, great. So I got a thumbs up from Tanipal. So Tanipal is okay with the answer. So let's move on to question number 3. Give the answer. Which of the following is best describing the lambda? Which of the following is best describing the lambda? A point on the calvaria at the junction of sagittal and lambdoid suture. It's a point on the calvaria at the junction of sagittal and coronal suture. Junction of greater wing of sphenoid, squamous temporal, frontal parietal, star-shaped landmark at the junction of petromastoid, occipitomastoid and lambdoid suture. So my dear aspirants, according to you, which is the best answer? Question number 3. Yeah, great. I am so happy. Okay, I am getting, so all of you have understood. Great. Okay. So yes, my dear aspirants, question number 3, waiting for the answers. Whether it is right and wrong, please attempt the question. Lambda, how you can divide lambda on the skull? How you can define lambda? Lambda. How you can define lambda? Question number 4, third, mark the correct answer. Okay, I got C as the correct answer. So yes, so here the question is targeting which point? Lambda. You have to know what is lambda. So yes, I am waiting for the answers. So let me see. Lambda. So yes, mixed bundle of answers are coming up. Okay, let me see who have marked it correct. So just asking about the lambda. Which of the following is best describing the definition of lambda? Okay, mixed bundle of answers are coming and I am so glad to know that the correct answer is A. Okay, it's a point on the calvaria, that is the skull cap at the junction of sagittal and lambdoid suture. So A is absolutely correct answer. Sure. So I just want to show you a diagram so that those who have done a mistake, nothing to worry. अभी हम diagram देखते हैं और उस diagram में हम lambdoid suture देखते हैं, हम bregma देखते हैं, and we will see asterion and the pterion, because these are the points which is important for you to know and you have to know the differentiation point. So let me show you a diagram. So I am just enlarging this diagram where you can appreciate the lambda. So okay, what is this suture? So this is which suture? So this is the sagittal suture. So my dear aspirants, lambda is at the junction of sagittal suture with this other sutures. Okay, this is the this one is the another suture which I am targeting. See here. So this is the lambdoid suture. So the junction of lambdoid suture, so I just wrote a point S. So junction of lambdoid and that of sagittal suture, what is it called as? It is called as the lambda. So what was asked? So the correct answer will be the junction of sagittal suture and that of lambdoid suture is called lambda. This was asked. So A is the correct answer. Now let me give you another diagram where you can clearly see the difference between the lambda and the bregma. So let me just highlight this. So this is which suture? This is the coronal suture and this is the sagittal suture. Okay, so see here. So here this is the coronal suture. So the junction of coronal suture and the sagittal suture. The junction of coronal and sagittal suture is bregma, and the junction of sagittal and the lambdoid suture is the lambda. So have you got the difference? Is the point clear, everyone? The difference between bregma and lambda. Bregma is lying anteriorly. It's when you will see the superior view of the skull, that is skull cap or calvaria, the junction of the sagittal and that of coronal suture is called bregma, and the junction of sagittal and lambda suture is called lambdoid. Okay. Now I would also like to show you another diagram where you can appreciate the asterion. So let's see the asterion. So okay, let me just highlight this diagram. So here you can see this landmark which I am showing you is the asterion. So let me just highlight, this is the junction. Actually asterion is lying at the junction of lambdoid suture. So actually it is formed by the junction of three bones: occipital bone, this is the parietal bone, this is the parietal bone, and this is the temporal bone, squamous part of temporal. So you can see here, this is the temporal bone, this is the occipital bone. So at the junction of these three, bones, that is parietal, that is the occipital, parietal and temporal, is the asterion located, So lambdoid suture, occipito-temporal sutures, temporoparietal sutures, all these together join to form the asterion. Now what was next, one more point which is very important for you to know is the H-shaped suture, and that suture is called asterion. So let me just highlight this diagram. Okay. Okay, now see here, this is so actually this is an H-shaped suture which is at the junction of four bones. So this is which bone? This is the parietal bone. So don't just let me highlight this. Okay, so see here, this is the parietal bone, this is the squamous part of temporal bone, this is the squamous part of temporal bone. This is which bone? This is the sphenoid, butterfly shaped bone, this is the sphenoid bone, and this is the frontal bone. So at the junction of these four bones, okay, so at the junction of these four bones, that is the frontal. So if I use green color for the frontal bone, so this is the frontal bone, this is the parietal bone, this is whole the parietal bone, this is the squamous part of temporal bone, and the greater wing of the sphenoid bone. So sphenoid bone, and this is the sphenoid bone. So is it okay? Can you see here the four bones? All of you, is the concept clear, crystal clear? Yeah, thank you. So sphenoid bone, the squamous temporal bone, the frontal and the parietal bone, all together they are lying at the junction, and this junction point is called as, what is this? This is pterion. This is pterion, H-shaped suture which is called as pterion. So this is what? This is pterion. So this is the pterion. Got it everyone? Okay, so just to make you understand, I sometimes highlight the diagram. Okay, so let's move on to question number 4. Let's move on to question number 4. Okay, so which are paired laryngeal cartilage? Which are paired laryngeal cartilage? Which are paired laryngeal cartilage? Which are paired laryngeal cartilages? Thyroid, cricoid, epiglottic, arytenoid, corniculate, cuneiform, arytenoid, cricoid, epiglottic, corniculate, cricoid or cuneiform. Question number 4, mark the correct answer. Your time starts now. Question number 4, mark the correct answer. Easy one. Which are paired laryngeal cartilage? Which are paired laryngeal cartilage? Which are paired laryngeal cartilage? So I got an answer from Goal to Ames is telling B as the correct answer. What about others? What about others? Sri Rangraj is also telling B. So mixed bundle of answers is not coming yet. So they are all at a similar point. Yeah, good one. So yes. So you just Goal to Ames, you just join me for the special session which I am starting from tomorrow evening on the special class. So I think I am targeting the clinical questions and the cadaveric image based sessions. So that will be more exciting also. So let's firstly complete the anatomy quiz. So I am getting many answers, and my dear aspirants, you all are absolutely right. Easy one. So the paired laryngeal cartilage is arytenoid, corniculate and cuneiform. Actually in the previous year this was the question asked in FMG examination. So revision is also required. So great B is absolutely correct answer. Absolutely correct answer. Okay, so yes, and this would become more crystal clear once we see this diagram. So see here, in this diagram, what you can see, this is the thyroid cartilage. So thyroid cartilage, so actually total this is the thyroid cartilage. So total we have got, okay, let me just zoom slightly. Okay, so okay, just yeah, like this. So actually we have got thyroid, we have got epiglottis, this is the epiglottis outline, and we have got cricoid. So these three, that is the epiglottis, the thyroid cartilage and the cricoid cartilage, these three are unilateral cartilage. These are unilateral, only one. But we have got, so this is 3 and we have got 3 bilateral. So they are 6. We have got cuneiform cartilage, corniculate cartilage and arytenoid. So see here, this is the arytenoid cartilage, and at the top of it, 2 other cartilages, small cartilage, which you can see here is the cuneiform cartilage, the corniculate cartilage. They are one on either side. They are one on either sides. So altogether we have got how many? 6. So total kitne cartilages ho gaye? 9. Larynx has having 9 cartilages. 9 cartilages. Let's move on to question number 5th. So let's move on to question number 5th. All the best. Mark the correct answer. Okay, question number 5th. All structures provide the boundaries for pelvic inlet except which of the following is not providing the boundary for pelvic inlet? Which of the following is not providing the boundary for pelvic inlet? Mark the correct answer. Which of the following is not providing the boundary for pelvic inlet? We have got 4 options and mark the correct answer. Question number 5th. All structures providing the boundaries of pelvic inlet except inferior ramus of pubis, sacral promontory, anterior border of ala of sacrum, arcuate line of ilium. Which one is the correct answer? Question number 5th. All structures provide boundaries for pelvic inlet except. Waiting for your answer. Question number 5th, mark the correct answer. So yes, I got an answer from goal to aims. What about others? So actually the session is containing 15 MCQs. Okay. Goal to aims has already given the answer. Okay. So my dear aspirants, I am getting correct answer from NJ 10 and goals aim 10. Okay. Actually, inferior ramus of pubis is not forming the boundary. It's not forming the boundary of pelvic brim or pelvic inlet. All other options, sacral promontory, anterior border of ala of sacrum and arcuate line is forming the boundary. So let me show you a diagram here which will again help you to understand the correct answer. Yeah. So here you can see, if I talk about arcuate line or if we talk about pelvic inlet and the brim, so it is having a line which is a continuous line, linea terminalis, which is formed by pubic crest, pecten pubis, arcuate line, margins of ala of the promontory, margins of ala of promontory. So all these structures together, so you can see here, so here we have got the promontory, then we have got the margins of ala of sacrum, and this is connected by arcuate line. Okay, and another is the pecten pubis. So we just connect the pecten pubis, and anteriorly we have got the pubic crest. So see here, this is how a continuous line is formed, and this is called as the pelvic brim. Together this is forming the boundary for the pelvic brim. Okay. So my dear aspirants, if you want to write quickly, So pelvic inlet, so you can write along with me, pelvic inlet or brim. So I would like to write all, actually it's not the inferior ramus of pubis, it's the superior ramus of pubis which contribute in forming, which is contributing in forming the boundary. So see here, so pelvic brim is formed by following structure or bony structure. Sacral promontory is contributing, ala of sacrum is contributing, sacroiliac joint is contributing, iliopectineal eminences, iliopectineal eminences, iliopectineal lines, iliopectineal eminences, upper border of superior ramus of pubis, upper border of superior ramus of pubis. It's not the inferior, it's the superior ramus of pubis. Other than that, pubic tubercles and the pubic crest, pubic tubercles and the pubic crest, and also the upper border of pubic symphysis, upper border of pubic symphysis. So my dear aspirants, this is all upper border of pubic symphysis. So what I have written is all the structures which is forming the pelvic inlet brim. So those who want to revise, they can quickly see this, they can take out the screenshot also and see this. These all bony prominences is forming the pelvic inlet brim or the boundaries of pelvic inlet. So moving on to question number 6. Okay, let's move on to question number 6. Which muscle passes through the lesser sciatic foramen? Which of the following muscle is passing through the lesser sciatic foramen? Question number 6, mark the correct answer. Which muscle passes through the lesser sciatic foramen? Obturator internus, piriformis, puborectalis, pubococcygeus. Question number 6, mark the correct answer. It's obturator internus, is piriformis, is puborectalis, is pubococcygeus. Which is the correct one? Question number 6. So your time begins now. Mark the correct answer. Okay, so yes, I got an answer from Tani Pal and Shri, and also from 10, Nirja 10. Obturator internus is absolutely right. Yes, the tendon of obturator internus is traversing through lesser sciatic foramen. Absolutely right, all of you. Absolutely right. Vanshika Tiwari, yes, absolutely right, dear. Absolutely right. So, my dear aspirants, firstly, I would like to show you this diagram where you can appreciate the muscle arising from this obturator membrane and all, and traversing, taking a 90-degree bend, and this is passing just below the lesser sciatic notch. This is passing just below this lesser ischial spine. So this is the ischial spine. This is ischial spine, and we can clearly appreciate in this diagram that below it, this will be the lesser sciatic notch. So this is obturator internus muscle. It traverses through the lesser sciatic notch. Now for those who want to revise, so they can quickly revise. So for those who want to revise, they can quickly revise the structures passing through greater and the lesser sciatic foramen. Structures passing through greater and lesser sciatic foramen. So this is the greater one and this is the lesser one. This is the lesser one and this is the greater sciatic foramen. Structures traversing are via greater sciatic foramen. Above the level of piriformis is the superior gluteal nerves and vessels. Below piriformis, following structures are passing through the greater sciatic foramen. Inferior gluteal vessels, inferior gluteal nerve, perforating cutaneous nerve, posterior cutaneous nerve of thigh, nerve to quadratus femoris, nerve to obturator internus, pudendal nerve and internal pudendal vessels. All of you, if you want to revise, please quickly revise the structures passing through greater and the lesser sciatic foramen, which has been shown here. So yes, we can clearly see this is the greater sciatic and this is the lesser sciatic foramen, and structures passing through greater sciatic foramen, the list is given, and the structures passing through lesser sciatic foramen, pin, P-I-N, also along with it tendon of obturator internus, pudendal nerve, P, internal pudendal vessels, I, and N for nerve to obturator internus. So this is the structure passing through lesser sciatic foramen. All of you please revise. This is an important point for your MCQ session, that the structure passing through greater and the lesser sciatic foramen. I have included this so that you can revise the structure. This is very important for your MCQ session, not only FMG examination, for INI CT 2021 and NEET PG also. Okay, let's move on to the next MCQ, that is MCQ number 7th. Which of the following is not innervated by cranial root of accessory nerve? Which of the following is not innervated by cranial root of accessory nerve? Which of the following is not innervated by cranial root of accessory nerve? Middle constrictor, inferior constrictor, palatopharynges or stylopharynges? Palatopharynges and stylopharynges. Okay, mark the correct answer. According to you, which is the best correct answer? Which of the following is not innervated by cranial root of accessory nerve? Middle, inferior, palatal or stylopharynges? Which is the correct answer? Your time begins now. Let me see who have given the right answer. So easy one. Okay. So D is the correct answer. D is the correct answer. D is the correct answer. Yes. So stylopharyngeus muscle is getting innervation by 9th cranial nerve. 9th cranial nerve. Charge. 9th cranial nerve. Charge. 9th cranial nerve, which is not innervated by cranial root of accessory nerve. Okay, yes, everyone has given the right answer. Yes, stylopharyngeus is getting innervation by 9th cranial nerve. All other options, if I talk about the muscles of the pharynx, that is superior constrictor muscle, inferior constrictor muscle, salpingopharyngeus, palatopharyngeus, all these except stylopharyngeus is getting innervation by that of the accessory nerve, vagus and accessory nerve together. Okay, it's by, actually the innervation is by vagus nerve, and this vagus nerve is carrying the cranial part of accessory nerve. It is carrying the part of cranial part of accessory nerve. Also here the muscles has been shown, superior constrictor, middle constrictor, inferior constrictor in this diagram. All is getting innervation from the cranial part of accessory nerve, which is carried by the vagus nerve, but not the stylopharyngeus. It is getting innervation by 9th cranial nerve. Moving to question number 8. Which of the following is the lymphatic drainage of the rectum? Which of the following is the lymphatic drainage of rectum? It's internal iliac lymph node, it's inferior mesenteric node, it's superior inguinal lymph node, or both A and B. Question number 8, mark the correct answer. Your time begins now. All the best to everyone. Which of the following is lymphatic drainage of rectum? Internal iliac lymph node, inferior mesenteric, superior inguinal, or both A and B? Yes, your time starts now. Mark the correct answer. Question number 8. Okay, waiting for your answers. So yes, goal to aims has given the answer. What about others? So Shri has also given the answer. And I also want to tell the students, those who have joined, that after completion of this YouTube session, I will give you a break of approximately 20 to 30 minutes whenever the session gets ended, of half an hour, and for 4 p.m. there is the continuation of quiz, and again at 6 p.m. there is continuation of quiz. तो आज एनाटमी का जो क्विज है वो 2 p.m, 4 p.m और 6 p.m का सेशन है. So I will take a quiz for 1 hour or 1 hour 15 minutes or 20 minutes like this. and then we can complete it. And on Saturday I am taking in the morning 10 a.m. quiz. So all of you do join for that quiz. Yes, I am getting many of the students has given the right answer, and absolutely right, it's both A and B. So all the students, please note down, when I am talking about the lymphatic drainage, actually the lymphatic drainage of upper part of the rectum, is draining into inferior mesenteric lymph node, This is the drainage for the upper 1/3. Now when I am talking about the lower 2/3 part of the rectum, its lymphatic is draining. Any idea? Its lymphatic is draining into internal iliac lymph node. So both is the correct answer. This is all about the rectum. I would like to show you a diagram for this so that your concepts are clear. See here, we are not talking about the anal canal, we are talking about the rectum. So here you can see here, this is the upper part of the rectum, this is the lower 2/3, and this is the upper 1/3 part of the rectum. So lower 2/3 part of the rectum, the drainage is towards the lymphatics is into internal iliac lymph node. So this is the lower 2/3 part, which is basically draining into internal iliac lymph node, as shown in the diagram. Right and the left side, internal iliac lymph node. And when I am talking about the upper 1/3 part, part of the rectum, its lymphatic is draining towards the common iliac lymph node, that is inferior mesenteric. In other words, it's the inferior mesenteric group of lymph node. Now what about the lower part? So when I am talking about anal canal, so see here, the upper part of the anal canal, if I am talking about the upper part of anal canal, it is again draining into internal iliac lymph node. But when I am talking about the lower part of the lower part of anal canal, it is draining into superficial inguinal lymph node. So many times this has been asked. So please note down, lower part of anal canal, superficial inguinal lymph node, upper part of the anal canal is draining into internal iliac. It is draining into internal iliac lymph node. Internal iliac lymph nodes. So I think the concept is clear. Let's move on to the next, that is question number 9th. Portion of hepatic artery. The portion of hepatic artery which is exactly located between the celiac trunk and gastroduodenal artery is known as. Portion of hepatic artery which is exactly located between the celiac trunk and gastroduodenal artery is known as proper hepatic, common hepatic, right hepatic, or the left hepatic. Your time starts now. Question number 9, mark the correct answer. Portion of hepatic artery which is exactly located between the celiac trunk and gastroduodenal artery is known as. So question number 9th, okay, I got an answer from goal to aims. What about others? Okay, so let me just tell you the correct answer. So yes, question number 9th. Yeah, the correct answer is common hepatic artery, and I would like to show you a diagram for this. This is a schematic diagram, and by seeing the diagram, the concept will be exactly clear that it's the common hepatic artery which is exactly located between the celiac trunk and gastroduodenal artery. So yes, let me just show you this diagram. So here you can see this is the common hepatic artery which is a direct branch from celiac trunk. CT, what do you mean by CT? Means celiac trunk which is given which is a ventral branch from abdominal aorta given at the level of T12. Direct branches are left gastric artery, splenic artery, and the common hepatic artery. These three arteries are the direct branches of celiac trunk. Now this is a schematic diagram to make you understand. Can you see from the common hepatic artery, one of its important branches, gastroduodenal artery, is arising, which is again giving two important branches. One is the right gastroepiploic artery, another is superior pancreatico-duodenal artery. Superior pancreatico-duodenal artery. Superior pancreatico-duodenal artery. So see here, superior pancreatico-duodenal artery, the right gastroepiploic arteries are the branch of gastroduodenal artery, which is a direct branch from common hepatic artery. And if we see the component of artery exactly between the celiac trunk and that of gastroduodenal artery, this component of artery is the common hepatic artery. So common hepatic artery is the correct answer. Thereafter, common hepatic artery will divide into proper hepatic artery, right and the left arteries, which will again give the branches as right gastric artery, and the right hepatic artery will give another important branch, that is cystic artery. So this schematic diagram is very helpful for you to understand all important branches of the celiac trunk. Done. Let's move on to the next, that is question number 10th. Question number 10th. Bifurcation of abdominal aorta. Bifurcation of abdominal aorta is exactly occurring at the level of that structure is exactly occurring at the level of crest of ileum, inguinal ligament, the pubic tubercle or symphysis pubis. Bifurcation of abdominal aorta exactly located at the level of which of the following structure? Question number 10th. Mark the correct answer for 4 options. Okay. So I am getting mixed bundle of answers like pubic tubercle. Pubic tubercle. Okay, I got an answer from Okay, AIIMS, actually I will tell you the hint. Now I think AIIMS, goal to AIIMS can give me the right answer, and all the students, I will give you a hint. All the bifurcations are generally taking at the place of L4, जैसे T4 हुआ, C4 हुआ, L4 हुआ, तो common bifurcations are at the level of 4. So L4 is corresponding to which structure? Inguinal ligament, pubic tubercle, pubic symphysis or crest of ileum. L4. It is occurring at the level of L4. L4 and L4 ke below, means in between L4 and L5. So which structure is corresponding to that? That is an hint provided. It's the crest of ileum. Is the crest of ileum is the correct answer. So A is the correct answer, dear. Let me show you a diagram for it. See here. A is the correct answer. Yes, Tyani Pal, yes, you are absolutely right. So this is the ascending aorta arising. So we know that ascending aorta is arising from left ventricle cavity, then it forms arch of aorta, then it goes into the thoracic part forming descending thoracic aorta. When it reaches the abdomen, it forms abdominal aorta, and abdominal aorta will divide into common iliac artery, and this division is corresponding to which level? Can you see here? What is this? It is corresponding to iliac crest. Iliac crest is corresponding, so exactly L4 vertebra or L4 and L5 vertebra ke beech mein, it is corresponding to L4 vertebra. So iliac crest we will mark as the correct answer. So iliac crest is the correct answer. Crest of ileum. Is it okay? Goal to AIIMS, Sri Tani Pal. Yes, very good dear. So let's move on to 11. So we have got 5 more MCQs. So let's quickly solve 5 more MCQs, then take a break of 30 to 40 minutes, and then again join 4 p.m. session, then again 1 hour session, then again a break of 1 hour or half an hour, and then again one more quiz is there. So all statement considering saphenous nerve is correct except question number 11th. All the statement about saphenous nerve is correct except it's the largest cutaneous branch of femoral nerve. It passes anterior to the medial malleolus and reaches the dorsum of the foot. It supplies the skin along medial side of the foot. It innervates the muscles of the foot in the medial compartment of the foot. So mark the correct answer. Your time begins now. Question number 11. So I got an answer from J. Nandal. J. Nandal has given the answer and he is telling it's the D is the answer. Okay, what about others? Question number 11. Actually D is absolutely right. It is a cutaneous nerve and how it can supply the muscle. So actually we know that saphenous nerve is a cutaneous branch from the posterior division of, it's a cutaneous branch from the posterior division of femoral nerve. So it's a branch of femoral nerve posterior division and it's the largest cutaneous nerve branch from the femoral nerve, which is giving innervation to that of the skin on the medial side of the foot and also passing medial malleolus to dorsum of the foot. But it is not supplying any kind of muscle because it is not a muscular branch. So see here in this diagram you can see here this is the femoral nerve which is descending below the inguinal ligament, and this femoral nerve is going down. It's one of its branch is saphenous nerve which is going towards, it also gives infrapatellar branches to the patella, and lower down it is going till the level of the medial malleolus. So it is giving innervation to the medial part of the foot and the medial aspect of the leg, as you can see here, medial aspect. So this is the saphenous nerve, but it is not giving any innervation to that of muscles. Let's move on to the next, that is question number 12. Layer of the scalp which is not included. Layers of the scalp includes all of the following. So all of the following which is mentioned here, layers: gallia, aponeurotica, adventitious layer, skin and pericardium. All these layers which is mentioned here, these all layers are included in the scalp, but which of the following layer is not a layer of scalp? Gallia, aponeurotica, adventitious layer, the skin or the pericranium. So mark the correct answer. Question number 12. So yes, I got an answer from few of you. Okay, adventitious layer. Yes, absolutely right. There is no layer like adventitious layer. Actually, when we talk about scalp layer, it is SCALP. It is the skin, it is the connective tissue, it is the aponeurotic layer of frontalis and occipitalis muscle, and it is the loose areolar tissue, and P for pericranium. So let me show you this diagram which will make you clearly. So this diagram is showing you the layers of scalp. Okay, so this diagram is showing you the layers of scalp. So from above to down the layers are, skin, subcutaneous layer, actually that is S, this subcutaneous layer means connective tissue layer, so this is C, aponeurotic layer is A, epicranial aponeurosis of occipitofrontalis muscle, L for the loose areolar tissue, and P for the pericranium. So this is the layers of the scalp. This is how you can spell out scalp and you can know the layers of scalp. So yes, is it okay? So yes, most of you are absolutely right. Let's move on to the question number 13. All the best for question number 13. Which of the following muscle produces intorsion of eyeball? Which of the following muscles produces intorsion of eyeball? Whether it is superior rectus and superior oblique, whether it is inferior rectus and inferior oblique, whether it is inferior rectus and superior oblique, superior rectus and inferior oblique. According to you, which combination of the muscle is the correct answer? Which of the following muscle is producing intorsion of the eyeball? Your time starts now. So write down question number 13 and give your correct answer. superior rectus and superior oblique, or inferior rectus, inferior oblique, superior rectus, inferior oblique. So A, B, C and D. These are the options and you have to give me the correct combination of muscles. Extraocular muscle action is very important for FMG aspirants and examination. You should know the action of each and every extraocular muscles. Okay, intorsion of eyeball. Actually, the correct answer is A. My dear aspirants, I just want to give you the answer. So, yes, A is absolutely correct. Why, I will tell you. Actually, superior oblique and inferior oblique. So many times we have discussed also, oblique muscle has got an action opposite to their name. So, अगर superior oblique की बात करें या inferior oblique की बात करें तो it's just opposite to their name. That means, so I will just write down the action of all the muscles so that it will be good for you. So, let me just, okay. So, if I talk about superior oblique and if I talk about inferior oblique. So, as I told you, oblique muscles has got an action just opposite to their name. So, it is superior, so it will cause depression of eyeball. It is superior, it will cause intorsion, medial rotation of eyeball, and these muscles, oblique muscles, are active in abducted eyes. So, abduction of eyeball. Inferior oblique will cause elevation just opposite to their name and will cause extorsion opposite to their name. And oblique muscle, as I told you, is active in the adducted eye, so abduction is included. So, this is about the two oblique muscle. Now, coming to the recti muscle, superior rectus muscle. So, when I am talking about superior rectus muscle, it will cause elevation according to its name, Other than that, it will cause intorsion. When I am talking about inferior rectus, according to its name, will cause depression of eyeball, Inferior rectus will cause depression of eyeball, will cause extorsion, and both these muscles are active in adducted eye. Now, two other that is very easy to remember, one is medial rectus and the other is lateral rectus. So, according to their name, their actions are, when I am talking about medial rectus, it will cause adduction of eyeball. When I talk about lateral rectus, it will cause abduction of eyeball. The seventh extraocular muscle is LPS. What is LPS? Levator palpebral superioris muscle. LPS means levator palpebral superioris muscle, and this levator palpebral superioris muscle will cause elevation of upper eyelid. Done? Yes, AIMS, yes, goal to AIMS I have written LPS, levator palpebral superioris muscle is causing upper eyelid elevation and levator, okay, goal, and levator palpebral superioris is a muscle which is having both striated, okay, both striated and smooth muscle. So, its smooth muscle innervation will be from the sympathetic innervation and its striated muscle fibers will get innervation from oculomotor nerve. So, that is the reason if you want to be complete paralysis of LPS muscle, so you have both the injury of sympathetic innervation and that of oculomotor nerve supply. All the extraocular muscles, so when we are talking about all the extraocular muscles are supplied by third cranial nerve. So, write on. So, we have done with this. Now, so we have done with this, and already I have given you the Explanation of the action. Now what is else? All extraocular muscles. Okay, all extraocular muscles is getting innervation from third cranial nerve except LR6 and SO4. What does this mean? Lateral rectus by abducer nerve and superior oblique by the fourth cranial nerve, trochlear nerve, fourth cranial nerve or the trochlear nerve. Now coming to question number 14. All the best for question number 14. All the best students. All the best. Lymphatics from upper limb will drain into which group of axillary lymph node? Lymphatics from upper limb will drain into which group of axillary lymph node? Whether it is anterior group, whether it is lateral group, whether it is central group, whether it is posterior group. Lymphatics from upper limb will drain into which group of axillary lymph node? We have got 4 options. Mark the correct answer. Anterior, lateral, central or posterior? Yes, Gold to Ames. Yes, it causes Horner syndrome. Yes, Gold to Ames. Horner syndrome hota hai, and the reason which is asked so many times that why there is partial ptosis. Okay, Gold. So partial ptosis isliye hota hai, partial drooping of upper eyelid, because both, for example, in case of Klumpke's paralysis, lower trunk palsy, lower trunk brachial plex palsy, there is sympathetic innervation gone. So still the third cranial nerve is active. So there is no total drooping of upper eyelid. There is partial ptosis. When there is injury to third cranial nerve, that is oculomotor nerve, still sympathetic innervation is active. So then also there will be partial ptosis only, not the complete drooping of upper eyelid. Complete drooping of upper eyelid will occur if there is injury of both third cranial nerve and that of sympathetic nerve. So I think this is clear to everyone. Goal to Ames. Okay. Yeah. So lymphatics from upper limb drain into which group of axillary lymph node? Whether it is anterior, lateral, central or posterior? Absolutely right. So the correct answer here is absolutely right, Shri. It's the lateral one. Absolutely right, Shri. It's the lateral group of the lymph node. Okay. So as we know, let me show you this diagram. Okay. So let me show you this diagram. So in this diagram you can see here there is 5. Okay. There is 5. One is apical, one is the central. Thank you, Shri. Thank you, Gold Shri. Anterior, there is posterior and there is lateral. See here. So these are, so anterior, posterior, lateral, central and apical. So actually apical is the terminal part. You can say apical is the terminal part of axillary lymph node, because all the lymphatics from the subsequent lymphatic group of axillary lymph node, that is from the anterior, from the posterior, from the central and lateral, will drain into the apical. So it's a terminal. Now when I am talking about the anterior one, it is draining the lymphatics from the most area of the breast and that of the upper anterior abdomen above the level of umbilicus. When I am talking about the posterior group, it is draining lymphatics from the posterior aspect of the back above the level of umbilicus and also from the lymphatics from the axillary tail of sphinx. Now, if I talk about the central one, so it is draining lymphatics from the anterior posterior group and also the lateral group, and the lateral group is draining lymphatics. Here you can see this is the lateral group. This is draining lymphatics from all of the upper lip. And from all these lymphatics, anterior group, posterior group, lateral, central, ultimately it will reach to the level of destination, that is apical group. So apical group of axillary lymph node is the terminal part of lymphatics. So all the lymphatics will ultimately drain into apical group of axillary lymph node. Is it clear? So here this was also a simple question. So here the correct answer will be lymphatics from upper limb is draining into lateral group of axillary lymph node. Done. Question number 14 is absolutely correct. Thereafter, let's move on to the next, that is question number 15. Okay. Which paranasal sinus communicates with the nasal cavity in the superior meatus? Which paranasal sinus communicates with the nasal cavity in the superior meatus? whether it is posterior ethmoidal sinus, frontal sinus, middle ethmoidal sinus, sphenoidal ear sinus or the maxillary sinus. Your time begins now. Question number 15, mark the correct answer. I will give you 30 seconds for marking the correct answer. So, I got an answer from goal to aims. What about others? Shri has also given the answer. Okay, so yes, let me give you the correct answer. Actually, the correct answer here is, so many of you have already, so yes, Shri, Gold, both of you have given absolutely correct answer, that is posterior ethmoidal ear sinus is absolutely correct answer. Posterior ethmoidal ear sinus, okay. So, I would like to show you a diagram for it, and it is very important that you should know all the sinuses. We know that there is superior meatus, inferior meatus, middle meatus which is located in the lateral wall of the nose below the turbinates and the concavs. So, below superior turbinate is superior meatus, below the middle turbinate is the middle meatus, and below the inferior turbinate is inferior meatus. And in this meatus, various sinuses are opening, and that is very important for you to know that which sinus is opening in which meatus and what is the location. Above the level of the superior meatus lies sphenoethmoidal recesses where the sphenoidal ear sinus opens. Actually, in this case, we have got A as the correct answer. Frontal sinus की बात करें, middle ethmoidal ear sinus की बात करें और maxillary sinus की बात करें. So, all these are opening into the middle meatus. All these are opening into the middle meatus. If we talk about sphenoidal ear sinus, it is opening in sphenoethmoidal recesses. Posterior ethmoidal ear sinus is opening in superior meatus. Now, let me show you a diagram for it. See here. Superior meatus is a narrow passage. Superior meatus is a narrow passage lying inferior to superior nasal concha or turbinate in which posterior ethmoidal ear sinus opens. Middle meatus contains the opening of frontal sinus, maxillary sinus, anterior middle ethmoidal, 4 sinuses. So, 4 important sinuses are opening into the middle meatus: frontal ear sinus, anterior middle ethmoidal ear sinuses, and the maxillary sinus. Yes, nasolacrimal duct, absolutely right, goal to aims. Nasolacrimal ducts opens in inferior meatus, absolutely right. Now, let me show you a diagram for it. So, in this case, you can see here that exactly in the sphenoethmoidal recesses, what I am highlighting is sphenoethmoidal recesses, which is located above the superior meatus, lies the opening of sphenoidal ear sinus. Now, the important openings for the middle ethmoidal ear sinus has been mentioned here, and the important openings are on the bulla. So, there is a elevation in the middle meatus which is called as bulla ethmoidalis. So, exactly on the level of bulla ethmoidalis, there is opening of middle ethmoidal ear sinus. Below the bulla, what you can see, let me use green color. So, this is the area. So, below the bulla, we have got hiatus semilunaris. And the structure opening in the hiatus semilunaris are maxillary ear sinus, anterior ethmoidal ear sinus, and frontal sinus. In this, frontal ear sinus is lying most anteriorly. Then we have got the middle ethmoidal ear sinus, and most posteriorly is the maxillary sinus. Now, if we talk about the openings which is seen in the inferior meatus, is the nasolacrimal duct is opening. So, only when we weep or cry, lacrimation occurs. So, there is also lacrimation and the running noses occurs, because nasolacrimal duct in the nasolacrimal duct opening is lying in the inferior nasal meatus. And when I am talking about So when I am talking about the opening of superior meatus, you can clearly see the opening in superior meatus is the frontal air sinus. So all of you please revise all the openings in the different meatus, because this is very important not only for your examination of anatomy but also for ENT MCQs. Absolutely right. Yes. So my dear aspirants, these are all openings in the lateral wall, and before ending the session, what I want you to tell that I am still coming up with the sessions. So 4 p.m. today, 4 p.m. and 6 p.m. and on Saturday 10 a.m. So this 3 sessions are more. These 3 sessions are there of anatomy quizzes. So all of you do join for this anatomy quizzes. This will be of 40-50 minutes each. I will take maximum 1 hour and this is the 4 p.m. 6 p.m. So 15 MCQs we will solve together. So yes, 4 p.m. 6 p.m. 10 a.m. YouTube session pay. Today and tomorrow there is anatomy quiz, so do join. And for Saturday and Sunday, so when I am talking about Saturday evening and Sunday morning, so when I am talking about Saturday evening sessions and that of Sunday morning session, because I know Sunday is a holiday for all of you. So yes, when I am talking about evening Saturday, that is 6 p.m. session, 7 p.m. session and 8 p.m. session, 6 p.m., 7 p.m. and 8 p.m. session, 6 p.m., 7 p.m. and 8 p.m. sessions on the Saturday, and Sunday 10 a.m. session and 11 a.m. session. Actually these sessions will be of 45 minutes each. 45 minutes each on the special platform where I will discuss cadaveric image MCQ sessions and clinical anatomy MCQ session. So all the links will be provided to you in the Let's Crack NEET PG platform, also in the group of Unacademy group. So all of you will present for the special free sessions of anatomy MCQs to be solved together, which will target you a better rank, and revision will be done. Cadaveric image MCQ sessions, clinical anatomy MCQ session. Saturday and Saturday is booked for Saturdays and Sundays for special free sessions on the Unacademy platform. Those who are watching the session for the first time, they will use the code ANAT10 to unlock the session. Firstly, they have to download the Unacademy app from the Play Store. Then they have to find their goal as NEET PG. Then they have to use the unlock code ANAT10 and they can present for my free sessions. And now take a break of half an hour of 45 minutes and again join me for 4 p.m., 6 p.m. and Saturday 10 a.m. morning, that is the YouTube sessions of anatomy quizzes. Okay, great. All the best, dear. All the best. Goal to aims. All the best, dear. Goal. It helped me to quick revision. Thank you so much. Okay, great one. Goal to aims. So yes, great one. So I am so glad that the sessions of mine is useful for you. So yes, if there is a time, you can be present for solving the MCQs, because MCQs are now coming in all professional examination also, and what is your target is the next. So for targeting the next examination, I am giving all the best to all the students and aspirants. So you have to solve the MCQs of all these examinations. Now before ending, thank you. So I want to thank all the aspirants, those who are present live. I want to thank them all, and I also want to tell them that I also want to tell them that subscribe the Let's Crack NEET PG platform of YouTube channel, like, share, download the PDF if you can download the PDF if you are attending special free sessions on the Unacademy platform. So you can download and you can have the notes or PDF notes also. So just avail this opportunity. Okay, avail this opportunity. And also those who want to see my free sessions or quizzes and want to give the competitive free test on the Unacademy platform, they can use the code ANAT10 and get enrolled. And also those who want to take the subscription of Unacademy, they can use my code ANAT10 and get 10% off in the subscription of Unacademy. So all the best, keep studying. Thank you so much. So let's meet again. What will be the timing? The timing will be 4 p.m. now on the YouTube. All the best, students. So I'm just ending the session now. We will again meet at 4 p.m. today sharp. 15 MCQs quiz is again waiting for you. Thank you. Thank you, aspirants.